What's up, you guys? My name is Miguel, fellow Xray Tech here, giving you the daily dose of radiation. So, in today's video, we are covering NG tubes or DOPAFs, whichever one they need. The protocol. So, to give you context, I'm night shift tech. Been doing it for about 4 years. So, usually a KUB is the standard set protocol for most places, because depending on who puts it in, usually that's where they want it, in the stomach, and you'll find it and it'll do the little loop-de-loop. So if it is not amongst like an upper KUB, if it's not there, sometimes you'll get it with just a chest x-ray depending on if they're small. But if it's not in the chest and it's not in the upper abdomen, usually it'll get coiled somewhere in their esophagus or in the middle of the chest, you can see. So as x-ray techs, we cannot say if it's in the right spot. Like once it passes somewhere past the abdomen, past like going down into the stomach area, we cannot say if it's in the right spot, because then we're liable. So we always tell them wait for the report. But obviously if it's coiled in their throat or in the middle of their chest, you can be like, obviously that's not in the right spot, try again. And then they can either, usually at our place, 3 times. If they can't get it after the 3rd time, they'll usually wait for IR to do it, which is interventional radiology, if you don't know. That's usually kind of how they do it. For nurse, usually it's the nurse who puts it in. Sometimes if they struggle, they can get the doctor to do it. And they should get suction, and you'll see whatever thing kind of suctioning out. That's how the nurses know if it's in the right spot, or they'll listen. But that's kind of it. Occasionally you'll have the infamous running back and forth from like the ICU floors, because they'll, like, the rad will say advance so many centimeters or retract so many centimeters, whatever, and it'll be kind of a back and forth type of thing. But usually ours, about the 3rd time, they'll kind of give up or let the day shift handle it. So yeah, it's been your boy Miguel. See you on the next one.